Armenia's Long Road to Health Equity. Article by Hranoush Dermoyan. Published on January 20, 2026 on EVN Report. Access to healthcare is not a privilege. It is a fundamental human right. Enshrined in international law and recognized by the World Health Organization's Constitution, the right to health guarantees everyone the highest attainable standard of physical and mental well-being. Yet for many Armenians, this right remains conditional, determined by income, geography, or circumstance. Universal Health Coverage, UHC, seeks to change that. It is grounded in the principle that everyone should be able to access quality health care without financial hardship, regardless of their social or economic status. UHC is more than a health policy. It is a social contract. It ensures that health services are affordable, equitable, and accessible, while also addressing the root causes of health disparities, from poverty to discrimination. Countries that invest in universal health care reap broad benefits. According to the World Bank, expanding access to health services protects the most vulnerable while driving economic growth, strengthening human capital, and fostering social stability. Healthy populations are more productive, resilient, and better able to contribute to national development. For Armenia, where healthcare costs push families into poverty and access depends on ability to pay, the transition toward universal health coverage is both a moral imperative and a strategic investment. It is a step toward reducing inequality, promoting sustainable growth, and ensuring that every citizen can live a life of dignity. Not merely survive, but thrive. A legacy of the Soviet model. Free healthcare is not a new idea for Armenia. Under the Soviet Union, the state guaranteed access to medical care. After independence, Armenia initially maintained this Soviet model. However, the transition from a planned to a market economy, combined with the aftermath of the 1988 earthquake and the First Nagorno-Karabakh War, placed immense strain on the system. At independence, Armenia's health infrastructure was in disrepair. Medical facilities were poorly equipped, and supplies were outdated. There was both an oversupply and uneven distribution of medical personnel. Primary care was underutilized compared to hospital and specialist services. Stark inequalities existed between urban and rural areas. Limited management capacity and weak financial oversight worsened the inefficient use of scarce resources. Out of this environment emerged the widespread practice of informal payments for medical services. By the early 2000s, as the economy stabilized, the government formalized the healthcare system by introducing a mixed model of free and paid services. In 2004, a government decision established the framework for free medical care, a policy that remains the foundation of Armenia's healthcare system today, despite multiple amendments. Over time, free services expanded to cover everyone under 18, pensioners, servicemen and their families, war veterans, social benefit recipients, persons with disabilities, women during pregnancy and postpartum, conscripts, prisoners, and other vulnerable groups. While this system has improved access for many, significant shortcomings remain. State budget allocations are insufficient, so funding for state-ordered PET-PAT-VER medical services often runs out before the fiscal year ends. Patients may wait months for treatment or pay out of pocket, particularly in the final quarter. When annual contracts are exhausted, hospitals delay care through changing scheduling systems, pushing many toward private fee-based services. Public trust in primary healthcare facilities, polyclinics, and ambulatories remains low. Many buildings are outdated and poorly maintained, lacking basic features like elevators for disabled patients. Long queues in crowded spaces discourage people from seeking care. Most diagnostic tests and specialist consultations in hospitals still require payment. Dental care is free only for children under 7 and certain vulnerable groups. Even when services are subsidized, patients often spend considerable amounts on medication and additional medical needs. The Ministry of Health procures medication for state programs, but quality concerns persist. Many patients prefer to purchase medicine themselves rather than rely on state-distributed supplies. Meanwhile, market forces increasingly dominate healthcare. Medical institutions often prioritize paying patients as they generate higher profits, leaving the social mission of healthcare underfunded and undervalued. The road toward universal healthcare. Following the 2018 Velvet Revolution, Prime Minister Nikol Pashinyan pledged to introduce a universal healthcare coverage system as part of a broader social reform agenda. In 2019, then Health Minister Arsen Taroshan announced the proposed model would be financed through a 6% tax on income to ensure equal access to medical care. However, disagreements between the Ministries of Health and Finance over funding mechanisms stalled the initiative. The plan, originally set to launch in 2022, was never implemented. By 2021, authorities renewed their commitment to universal healthcare, announcing the system would be introduced by 2024 at the latest. Yet financial and administrative challenges forced another postponement. On January 1, 2026, the government finally rolled out the first phase of universal health coverage. Unlike the earlier proposal of a flat percentage tax, the updated model uses a fixed monthly healthcare fee paid by taxpayers. However, not everyone will pay the same amount. Initially, the coverage will extend health insurance to around 1.6 million people. The first phase includes children aged 0 to 18, citizens over 65, people with disabilities, individuals with functional limitations, socially vulnerable groups, families of fallen service members, and people earning 200,000 Armenian drams or more per month. A substantial segment of the population will remain outside the insurance system during the first phase. This includes individuals who do not belong to priority social groups and whose income falls below the defined thresholds, employees earning 200,000 Armenian drams or less, small-scale entrepreneurs with annual turnover below 2.4 million Armenian drams, self-employed farmers and individuals whose income comes from passive sources such as rent, dividends, or interest. They will be integrated during the second phase, scheduled to begin on January 1, 2027. While these groups will not receive the insurance package during this phase, they remain entitled to a minimum volume of medical services guaranteed and funded by the state. Those who fall into any of the designated vulnerable categories are fully covered under the healthcare package. By 2029, the government plans to extend universal health insurance coverage to all citizens and residents of Armenia. While the state will fully cover the insurance premiums for vulnerable and priority groups, salaried employees will contribute to the insurance fund. The annual premium is 129,600 Armenian drams, or 10,800 Armenian drams per month, that will be automatically deducted from wages. The state will fully cover the cost for children, seniors over 65, socially vulnerable groups, and families of fallen service members. For employees earning between 200,000 and 500,000 Armenian drams per month, the state will subsidize most of the contribution in 2026. Government funds currently allocated to the Insurance Foundation for Servicemen, a tax for servicemen's needs, will be partially redirected to the new insurance fund, reducing monthly payments. For citizens earning between 500,000 and 1 million Armenian drams, 7,500 of the 8,500 Armenian drams currently allocated to the Insurance Foundation for Servicemen will be redirected to the insurance fund. The remaining 3,300 Armenian drams will be withheld from salaries, but can be fully refunded in 2027 as an income tax refund through the individual income declaration system. A newly established insurance foundation will administer the reform. It will be overseen by a board of trustees, with its director selected through a competitive process. Medical services covered by insurance will be available at both public and private healthcare facilities. Detailed lists of covered diseases, screenings, diagnostics, and medications will be published through the Armed app and official government websites. According to Samvel Karazian, chief of the State Health Agency, the main reason for the repeated delays was difficulty securing adequate funding. The first phase excludes people aged 63 to 65, as the government could not secure an additional 9 billion Armenian drams, though it hopes to do so in later phases. He also explained how the system will function. The insurance model itself is universal comprehensive health insurance, meaning the state will cover the main risks. The government will establish a fund that collects resources through insurance payments and ensures the provision of medical services in return. Addressing concerns about potential system overload or inefficiencies, Karazian noted that such risks are minimal. If ongoing monitoring shows that certain problems may arise, we'll take corresponding measures. At the very least, we will implement a scheduling system so that all planned cases go through a waiting list. There are also mechanisms to temporarily limit certain services if necessary, he explained. All these tools can be applied to manage the situation effectively. The case for free healthcare. The proposed model represents a structural transformation in how healthcare will be financed and delivered, but its broader justification lies in the country's pressing social realities. The push toward universal and eventually free healthcare stems from growing recognition that health-related expenses have become a leading cause of poverty and inequality in Armenia. According to the Armenian authorities, around 9% of the population spends more than a quarter of its household budget on healthcare, pushing roughly 6% into poverty, the highest rate in the region. Many others, particularly low-income families, avoid seeking medical care altogether due to financial barriers. In response, the government's 2021 to 2026 program names healthcare development as a national priority, pledging to protect and improve both individual and public health through accessible, high-quality, and modern medical services. The new draft bill on universal healthcare cites international assessments showing that Armenia's healthcare system performs well when adequately funded, as reflected in improvements in life expectancy and declines in maternal and child mortality. Yet the resources sustaining these gains remain insufficient. Over the last 25 years, public spending on healthcare has averaged just 5.4% of total budget expenditures, about 1.4% of GDP, 4 times lower than the average among countries with comparable income levels in Europe and Central Asia. This chronic underfunding has fragmented service delivery, left reimbursement rates below real costs, and contributed to a shortage of specialized medical staff. Limited financial access has also discouraged people from seeking care. 12.6% of the non-poor, 24.5% of the poor, and nearly half of those in extreme poverty. The government acknowledges systemic inefficiencies across healthcare management, primary care, pharmaceuticals, information systems, and workforce development. Insufficient public financing and weak spending oversight have constrained the quality of care and driven families deeper into poverty through catastrophic health expenditures. To address these challenges, the government aims to enhance financial protection, reduce the reliance on out-of-pocket spending, and improve healthcare spending efficiency. A central measure is the introduction of a prepayment model that combines state co-funding with an independent body for strategic purchasing of medical services. At the same time, reforms in primary care and electronic health systems are strengthening the sector's foundation. Together, these initiatives, from universal health coverage to system-wide modernization, reflect Armenia's broader commitment to making healthcare a right, not a privilege. However, experience, and Armenia's own track record, shows that large-scale reforms often stall and run into serious implementation challenges. It remains to be seen whether the authorities can navigate these obstacles and deliver on the promise of accessible, effective healthcare.